since tested. That might be a good sign, but who had since tested positive for COVID. And as you would expect, that led to an immediate response on the part of the health service, who knows this community better than anyone. And indeed, because of the expert care provided by the health service to quickly identify the case, but also get the public health unit involved, we're very much in the process of ensuring that we're putting rings of care around that particular person, but also their close contacts, and identifying where else in the town we might need to be doing that. So clearly there's not much more information I can give. I can't give detail about the person, and we're still in the process of identifying and understanding the movements of that person. But in the meantime, we're here to answer questions. I've just got a message from Trevor to everybody. He's saying that East Wimmera Health Service will be recording this and we'll be putting it onto Facebook. I'm actually don't know if because there's so many people here, I can't actually tell whether there's any colleagues on this from East Wimmera or whether I'm absolutely flying solo. If I am flying solo, then here's Jade. Actually, that's great. I can see Jade there. That's good to know. So Jade, as you will know, is a very talented infection prevention control officer who, by the time that public health knew about this, Jade already and the team had already essentially made sure that any risk was particularly as closely managed as possible. So
looking at that Irish pub down there in Ballarat in the main city, what's that called? That pub called? It's an Irish pub. I know that.
Oh, here it is here.
Hold on a second. There's a bit of conversation happening. If you're not actually asking me a question or asking Jade a question, can I ask you please to put your microphones on mute? Thank you. So what I might do is just give some very general information about what happens in a situation like this.
Children therefore believe that he's a buyer for this rebel group. It's shocking.
Someone was trying to tell me that I was muted also. So thank you for that. I'm not quite sure what's going on with our IT today, so just bear with me. Thank you, Tanya, for, I think you gave me some sign language there. I'm very grateful for that. So what we normally do in response to a case from a public health perspective is we have quite a simple response. It's something that I talk about where we obviously get to know, we talk to the case, we find out, find out how they are, and if they need care, medical care or healthcare, we refer them to that. But there are questions we ask of a case to try and understand, to contain what it is that we need to do, where they've been, who's been there with them, what their movements have been, whether it's been work or a household or education or childcare or social visits, all of those sorts of things. The vast majority of people who are coming to our attention with COVID in the state are either household contacts of people we already know who are COVID positive, or people who have been unknowingly exposed and are unknowingly infected. More and more of the people we are coming into contact with have had no idea that they've been exposed, because Delta is like that. And then once we've had those conversations, we then set about contact tracing. You've heard those words many times. And contact tracing means we identify who needs to be tested, and the instructions we give them to either isolate for the whole 14 days if they're called what we call a primary close contact. They've had enough contact with the person while infectious that they're at risk of becoming infectious themselves over the course of the following 14 days. So they need to quarantine, isolate at home rather. Or if they haven't had a lot of contact, but there's still a risk of exposure to them, in which case we might ask them to stop where they are, go home, get a test, and isolate until they get a negative result. And then, of course, we try and communicate, which is what this forum is for. And then we keep a town like St Arnaud, we keep posted with regular communication. And indeed, the health service will be the source of truth in that communication. And the public health unit will be working very closely with the very strong leadership we have in the health service at St Arnaud to be able to provide that advice. So without mindful that we're early on in this particular process, although having said that, because of the strength of the health service, a lot of the footwork has been done at this stage with respect to stopping the risk where it is, and especially in the town. I might leave it there unless, Jade, in general, you want to make any further comment, and then we can potentially try, if people put their hands up, to see if we can have some questions. There's already some comments in the chat, I see. Over to you, Jade.
Thank you very much, Rosemary. So for those who don't know you, as Rosemary introduced me before, I'm the Infection Control Coordinator at East Wimmera Health Service. Rosemary's covered a fair bit, so I don't want to repeat anything in what she said. At the moment, the situation is still unfolding, and as we gain more information, we will certainly provide that to the community. I strongly encourage and recommend everyone to continue to monitor our Facebook page and our website, as we will be updating this very regularly with any new information that comes to light. We'll also be providing information in relations to swabbing that will be occurring at St Arnaud over the weekend. So again, please just keep referring to this. If you have any questions or concerns, please do call our service, but be mindful that you know, we are under a lot of pressure at the moment with providing continual care and things like that. So we will try and get to you as we can, but the best method at the moment is to continue using the social media to monitor for any updates or progressions with this. So.
Okay, so there's a question in, there's a couple of other things I'd like to say. First of all, as we've been saying for a long time, our strongest defence against COVID is vaccination. So we know that in a lot of ways, our towns around rural and regional Victoria are highly engaged in the vaccination process. Many GPs who are actively involved in that, and our health services are actively involved in providing vaccination. So the strongest defence we have against COVID is vaccination. As Jade has said, can we please remind people for this moment at least, or for this short time, to be very careful and very cautious about your interactions with others until we're confident that we've contained what we need to contain. And that is around maintaining your physical distancing, attending to hand hygiene, being very careful around wearing your mask whenever you're outside your home, abiding by, while in regional Victoria, with the exception of Ballarat, ironically, you're able to go about your business freely. Just be mindful that we have got, you know, COVID in the community, so therefore there's a certain amount of risk attached to that. Although at this stage, from our inquiry so far, we feel like we've come to know this very quickly, and so we're very hopeful we will be able to get on top of it, just like we did with Dalesford last week. So I'll just go back to some of the questions. We know that testing is being offered. Susan, I spoke with earlier today, is leading that testing team for St Arnaud's at the health service, and or wherever that's located. Obviously, I'm calling from Ballarat, so I'm unfamiliar with the locations in St Arnaud where this is working. So testing is available, and this is the town of St Arnaud who will really be the strength of this response, just as we've found in other similarly sized or slightly bigger towns. But it's times like this when a town comes together and supports each other to do what we need to do. So the important thing is that once people with symptoms, we ask for anybody with symptoms to come forward, of course, and get tested. But we are, I understand Jade and Trevor will be able to provide information on the website about the testing times, the locations, and we'll continue to test for as long as, well, I understand we'll be continuing to test for as long as is needed to ensure that we've got good confidence about what's happening in the town. I, off the top of my head, don't have the percentage of vaccinations within the Shire, but I know that regional Victoria is doing better than metropolitan Melbourne. And indeed, I'm confident that I think all of the LGAs within the Grampians region, which includes where St Arnaud is, are doing better than Ballarat. And I know Ballarat's about to approach 50% fully vaccinated and have already exceeded 70% at least one dose. So that's a great achievement on the part of the community of St Arnaud and indeed the LGAs there. Can we still move about in line with current restrictions? Yes, you can. There's no requirement other than, as I've just said, please be careful and cautious. I would, you know, in this environment, until we've got a really good handle of it, I'd restrict movement. If it's unnecessary, then, you know, don't do more than you need to. Certainly be very careful about not gathering in groups, and not gathering in groups. And my colleague Robin Wilson, who is also here, I can't quite see or find. We've got some advice for what should I do if I'm identified as a primary close contact or a secondary close contact, or I've been with a friend or my household member. And what we'll do is we'll send that to Jade and the team at the Leadership of Health Services, and then that can be posted also on social media and on your website, Jade, I think, for people to refer to if they have common questions about, I've just been identified as a secondary close contact, what does that mean? Just so they can be referring to your website, Jade, and around that messaging. So hopefully it will be some simple messages for people who may need that. Another question is, there are currently 100 people in the meeting. It's being recorded. That's good news. And it'll be on the website and Facebook at East Wimmera. When do you think exposure sites might be announced? We're hoping that exposure sites will be announced imminently, in as much as we're making those phone calls now. There are only a few at this stage. And we're just going through an evaluation process, because as you'd appreciate, if there are exposure sites, we need to know who else might have been there at the time. It's not just a site, it's often because there's humans there too. So we want to make sure that we've done what we can, at least with the exposure sites, to have had those conversations, so that if we need to contact people who've been at those sites, we know who they are and we can be contacting them in a timely way, so that we're trying to reduce anxiety in that way. Okay. I can't see any other question, or maybe I'm not scrolling down properly. The St Arnaud Community Cinema has screenings for 20 people max tonight and Sunday afternoon with masks sanitizing. Can we proceed? Can I take that offline? I need to be thinking about that. It might be useful and cautious to hold off today, I would suggest, and to hold off today and to reevaluate that. I think until we're quite confident that we've been able to put those rings of protection around the exposure sites and anybody who might be attached to them, I would suggest that going ahead with the cinema tonight might be a tad risky, because in public health, to get ahead, we have to think ahead. So we're not only concerned with the case and their close contacts, but the close contacts of the close contacts. And that might take us a little time to get to. And unfortunately, they may not have the message by later today if we haven't been able to get onto them. So we don't want them turning up at a cinema and potentially worsening the situation. Thanks very much, Stephen. Thank you. That would be my advice on the hop, but I just think we need to start from a position of caution at this stage, and certainly we'll be able to work with the community over the coming days to have more confidence about what we've been able to do. Has there been any contact with neighbouring towns? Not that I know of yet, but of course, if there are people whose daily lives are in St Arnaud but who live in those neighbouring towns, then again, we'd be asking people who to be sensible and cautious about what it is we're dealing with now. Is it worth getting tested to rule ourselves out? It is worth doing that, I think, but I would ask you that if you don't have symptoms today, perhaps hold off until we know we've had the chance to test everybody with symptoms. And then we might, yes, tomorrow, ask people, even if the slightest of symptom or concern, to come forward. Jade, I would just run that. I'm again answering this on behalf of East Wimmera Health Service without having the Chief Executive here. So I'll just see if I can get a thumbs up from Jade if that sounds about right.
So what we would like to see is, as you said, anyone with signs or symptoms to please come forth. We've got a COVID swabbing clinic running as we speak out of the St Arnaud site. It's a drive-through clinic and you do not need to have an appointment. We would like anyone who has signs or symptoms to please attend. Anyone who's been contacted by our health organisation or by the public health unit, please come forth and get swabbed. Anybody else, if you don't have signs or symptoms or you haven't been identified via our health service or via the public health unit, we do request that you maybe hold off for now, because we do want to swab the people that have been recognised or who are at a higher risk. We understand there is a lot of concern, but we do want to obviously attend the people that require the swabbing first. So if you don't have signs or symptoms or you haven't had contact by the department or ourselves, please just hold back from attending the clinics for now, because we have a high demand and we obviously don't have staffing capabilities to be swabbing the whole town. So
thanks, Jade. And Fiona's asked a really good question, which is what signs and symptoms should we be looking for? And we now have a very broad range of symptoms, particularly if you're getting a cold or feel like you're getting a cold. So a headache, a sore throat, a snuffly nose, which is unusual, feeling generally unwell, aches or pains. Delta can disguise itself in lots of different ways. So we want you to come forward at the slightest of symptoms. Essentially a respiratory symptom, but also headache is now part of the part of something we might look for. And again, any aches or pains. Even if it does turn out to be just a simple cold, it's much better to be safer than sorry. So we'd ask you to come forward at the slightest of symptoms. Right, and Trevor is actually on the chat, which potentially means that Trevor is in the meeting somewhere. So Trevor, if you are and if you are able to speak, then I'd be very keen for you to just chirp up if you need. I can't see you and I can't hear you. I can see you. So all I can see is your name, Trevor, with your microphone on. So if you'd like to try and see whether or not your microphone's working now, then I might just for a moment hand over to you.
So Rosemary, how does my audio sound? No, I think this is the problem. I have to stay on the chat. And,
okay, thanks, Trevor. No, your microphone.
Yep.
Yeah, sorry, your microphone is making it impossible to hear. Except I heard you say chat, which was good. So thanks very much for that, Trevor. So if you have other questions, particularly about how St Arnaud's Health Service is managing this, then by all means, please put that in the chat and Trevor's there to answer. What websites do we go to for updates of exposure sites in St Arnaud? Another good question, thank you. And I'll come back to India's question in a moment. What websites? So there are two websites. Certainly we'll be putting information, at least St Arnaud's Health Service will be putting information on the St Arnaud's Health website once we've, as I said, contacted and ensured that we've appropriately understood the exposure site so we can give you appropriate advice in relation to those exposure sites. But also there's any exposure sites that require either a tier 1 or a tier 2 response will also be on the Department of Health's website and with a map on the map also. And that takes a little longer, which is why we'll be asking St Arnaud's Health Service to have it on their website, again, hopefully by the end of the day. India had a question, do we know if the positive case is confirmed Delta strain? It's been a very long time, India, since we've had any coronavirus which wasn't Delta. So I haven't got that confirmation. I'm just making the assumption that it is. And we treat everybody as if it is, which means we know from Delta that it's more infectious. It does make people sicker. It is more rapidly spread. So we've got evidence. You might remember when our removalists came to Melbourne, we had someone, they came on Thursday, they infected someone that day, who infected someone on the Saturday, who infected someone on the Monday, who infected someone on the Wednesday. So it is possible to get quite rapid spread, but you have to have the conditions right to make that happen, and lots of close contact. From what we can tell, we don't think that is the case with this particular person while they've been out and about. So to any particularly great extent, with the exception of maybe a couple of sites. So it can spread quickly, which is why we ask people to be very careful and very cautious about who you might be communicating with at the moment, you know, in touch with and in contact with now. Essential workers, transport drivers require regular testing, turn up for testing. What we want to do, and I would say yes to that, because what we want to make sure is that people who may be unknowingly exposed and unknowingly infected and may indeed have no symptoms, but have the risk of taking COVID with them somewhere if they are infected, as a small risk as it might be, I would prefer to have them tested today, if indeed the testing capacity can manage it. So I would think that would be an important reason for us to exclude COVID in those people. But remember, if you are turning up for a test today, I know you're tested regularly, but if you are turning up for a test today, it's really for the purposes of having you stop where you are until you get a negative result, because we're wanting to stop spread. It's not necessarily to assure a person so they can then go about their business while they're doing it. This is actually trying to detect COVID in a community where there is COVID. So we would probably ask you to just hold off on your transport work while indeed there's a low risk, but at the same time, we don't want to necessarily be spreading this any further than it is going, than it may otherwise already have done. Okay, so can we extend the testing, yes, to retail workers? Look, can I actually leave St Arnaud's to make those calls about extending testing and who's going to get tested because we do want to make sure that everybody who's symptomatic gets tested first. And I'm mindful that if I start saying that all of these other people could get tested, we might be squeezing out some people who are already symptomatic. Having said that, it is really important, I appreciate, to try and very quickly make sure that retail workers and transport workers are tested so that we're making sure that we're not exposing people and we're not spreading. With respect to retail workers, and we'll be able to tell this later today, unless we think your site has been an exposure site, then we won't be asking retail workers to get tested in particular. And certainly we're in the process now of talking to those exposure sites. So just hold tight on that one. And if we ask you to get tested, then please get tested, but otherwise you can be tested along with everyone else after today. Given the Delta facts and knowing that the person was at a few places for enough time, given the size of St Arnaud, why not do a mini lockdown till more is known, seeing as Ballarat was locked down for 3 cases? Okay, 2 things about that. I can speak very well about lockdown in Ballarat because I've been very much a part of that for the last week and a half. So Ballarat was actually not locked down only for 3 cases. Ballarat was locked down because we had numerous increasing, widening spread of wastewater detections. So we knew that there were more than 3 cases in the community, and indeed they've now come to light and are continuing to come to light, which is why there's a massive response in Ballarat. And the reason we locked down is because we're concerned about uncontrolled, undetected spread. There's nothing so far in St Arnaud which makes me think that. So I want to get that point it's a really good point to make, and it's a really good point of clarification to have me explain, but I want to be very clear about that. There's nothing yet to make me think that there's uncontrolled, undetected spread in St Arnaud. We're working to make sure we've contained, just like we did in Daylesford this time last week. We're working to make sure we've contained, and certainly with the great support of St Arnaud Health Service, I'm sure we'll have more information about that in coming hours and indeed over the course of the next couple of days. I don't know if wastewater is detected where you are. I imagine that others who are in St Arnaud will know that better than I am, but I haven't heard that there have been any detections. We do know that there is sporadic detection all across Victoria, and I would have thought that had there been a positive detection, all of us would certainly know that by now. It is possible, of course, in rural communities that a detection may not show up if someone has been using a septic system, for example. So septic systems can be tested separately, but obviously they're only tested when the septic tank is emptied. So it is possible that something like that could happen, but in a city, in a town like St Arnaud, I don't think that, as I said, we haven't had any detections yet. Okay. And forgive me if I'm saying things which are not necessarily correct about the town. It's not a town I know well, which is why I really wanted to have Trevor here today, and we have Jade as well, of course. But there will be more information, I imagine, that Trevor will be able to provide with other civic leaders about the nature of the town. Okay. Okay, there was a question above about vaccine, which I need to scroll up and try and find it. Jade, can I trouble you to try and find that question about vaccine, please? Trevor's alerted me to a vaccine question that I've missed. And so with respect,
I believe the question, sorry, my apologies. I believe the question was, is it okay to attend appointments to get the vaccine if you're not showing symptoms?
Yes, it is, and clearly but we do, again, just please ask, take care and take caution, and how that vaccine clinic runs is part of St Arnaud Health Service. So I would suggest make sure you check St Arnaud's Health Service about whatever changes there might be. At this stage, I'm not recommending any changes be made to that service. So it's so long as you have no. What I might do actually is very quickly, we think we'll have those exposure sites available. So Jade, we might just hold off for an hour or two, and until we've got those exposure sites, to give people the chance to check the exposure sites, and if they have been to an exposure site, then they should hold off on vaccination. So if you are someone who's lined up for an appointment of vaccination, then we can work that out, unless there's some other way we can contact people.
So Rosemary, sorry, I'll just chime in there, sorry, because I lead the vaccination program within our organisation, so I can answer some of these questions.
Right.
So as Rosemary has said, we are hoping to have the exposure sites list within the next hour or so. Obviously, if you are identified as attending one of these exposure sites, we request that you follow the direction that's put out by Public Health Unit, and of course we'll provide that information on our websites. In relation to attending the vaccine clinics, at this point in time, our next clinic is booked for Thursday the 23rd at St Arnaud. Okay, and at this point we have not made any changes to this vaccination clinic. However, with the ongoing situation and how it develops, this may change. So again, I request that everybody keep looking at our Facebook page, keep looking at our website. If we are going to make any changes directly to this clinic, we will make contact. Someone from our team will make contact with you in relation to your appointment and your booking. If by some chance we do have to cancel the clinic, we will certainly get you booked in as soon as we can to another clinic and make sure that we provide you with the vaccines. At this point too, we will continue to take bookings for vaccines. So please just continue to follow our previous directions of making contact with our health service, and we can direct you to our admin staff who undertake our booking services. So please don't hesitate if you are wanting to get vaccinated and you're not showing any signs or symptoms and you haven't been identified as attending an exposure site, please don't hesitate to make contact with us to get booked in. But at this point in time, no changes to our vaccination program or clinics.
And I'm terribly sorry for the IT issues at the start. I know that no one wants all of that. We're happy to have these forums ongoingly if we need to, but I'm afraid I have to go because I have to do now my counterpart forum for another location. So forgive me for leaving. I'll hand back to Jade and to Trevor to take it from here with respect to fielding any further questions, but I'm afraid I need to leave this Zoom now. So Jade, I'll hand back to you to field anything further, but I'm afraid I have to leave. So thank you everybody for your time. Best wishes.
Thank you very much, Rosemary. Much appreciated you attending.
Thank you. Bye-bye.
I believe that our CEO, Trevor Adams, is still out of action due to technical issues. So if there is anybody who has any further questions, please continue to put them into the chat and I will try and answer them as best I can. As we've said, the exposure sites that have been identified should be notified within the next hour. We will be listing the exposure sites on our website and on our Facebook page, and they will also be listed under the Department of Health and Human Services on the exposure site list there. So you can go to the department's website or you can continue to use East Wimmera Health Services website or Facebook page. As I mentioned earlier on in the meeting, we will, as we gather information, we will certainly be providing it to you through social media. We can only provide it as we get it. So unfortunately, sometimes we are unable to provide a lot of information, but we will certainly, as it evolves and as we get the information from the department, we are certainly putting it out there to our community members. So contact tracing has commenced. As mentioned, we are aware that there is a couple of exposure sites and they will be listed and made available and known to the community within the next hour. So in relations to movement, within the next hour, we should know what exposure sites we have. Certainly, if you have been to one of these exposure sites, we request that you get tested immediately and isolate. At this point in time, we can't say not to restrain your movements only to locally. That's a decision that you yourself need to make. We can only advise that if you have been identified as being at an exposure site, then most certainly you need to be swabbed and you need to isolate and wait for further direction from the public health unit. So currently there is no, we are unaware of any surrounding towns that have exposure sites. As I said, there's only been a couple of exposure sites identified in St Arnaud at this point in time, but obviously the situation will continue to progress. If there are further cases developed, then this may increase our exposure sites and may increase into surrounding towns. But currently, at this point in time, there is only a couple of exposure sites identified within St Arnaud. So I'm going to finish up very shortly. So I'm just going to answer the last few questions that we've got here. In relations to vaccines, as I said, we're still running our clinics. If you would like to be vaccinated, please don't hesitate to contact us and we can put you on our clinic. Our next clinic is scheduled for Thursday, the 23rd at the St Arnaud Town Hall. Yes, if you've used the QR code and you've been identified as being at an exposure site, you will be contacted by the public health unit. Okay. Look, thank you everybody for attending the meeting. We appreciate the efforts everyone's made to come on board and attend. We understand that it is a very concerning time for everybody, and we appreciate everyone's patience with this. As I said, we will try and provide you and continue to provide you with the information as we know it, but it does take some time. So unfortunately, we can't provide you with all the information that you may be wanting or needing. We will provide it as it comes. Please, over the next hour, keep an eye out for our website and our Facebook page, as we will be displaying the known exposure sites. If you have any concerns or questions, as I said, please, don't hesitate to call the hotline, the COVID hotline, or the public health unit. Please be aware, if you are trying to contact our organisation, there may just be a delay, as our staff are currently busy undertaking the COVID swabbing, and also obviously dealing with the presenting situation. So again, I would like to thank everybody for attending, and please keep safe and look after yourself and each other. Thank you.